Remember, World Cup Eco KBC, hashtag World Cup Eco KBC. Our socials at KBC Channel 1, and our sign language expert tonight is Caroline Njoroge. Now, on to health matters. Israel's Ministry of Health has removed Kenya and Rwanda from the list of countries subject to temporary Ebola-related entry restrictions.
Now, the decision comes just hours after the Kenyan government protested Israel's decision to include the country among those whose travelers will face entry restrictions over Ebola concerns. Foreign Affairs Principal Secretary Korir has welcomed the move, describing it as a show of sensitivity, friendship and partnership. Now, meanwhile, the Ministry of Health has maintained that the county remains Ebola-free, with all 91 suspected cases tested turning negative. Here is that report.
In a notice dated 10th of June 2026, Israeli head of border control Amnon Shmueli directed airlines to deny boarding to foreign nationals and residents from 5 countries traveling to Israel. The affected countries are Kenya, Uganda, the Democratic Republic of Congo, Rwanda and South Sudan. Further, the airlines were barred from boarding foreign nationals of any citizenship who had stayed in or visited any of the 5 countries within 21 days before their scheduled flight to Israel. It is this notice that prompted a protest from the Kenyan government, with Foreign Affairs Principal Secretary Korir expressing the country's dissatisfaction through his X account. 5 hours later, the Israeli embassy to Kenya announced through the same platform the decision by Israel Ministry of Health to remove Kenya and Rwanda from the list of countries subject to temporary Ebola-related entry restrictions. In his response, PS Sing'oei termed the move a show of sensitivity and friendship.
So there have been
This comes as Public Health Principal Secretary Mary Muthoni maintained though the country is considered high risk, systems are in place to contain entry and management of Ebola.
While Kenya currently has 0 cases, our rapid response teams must remain fully mobilized because Kenya remains at high risk on high alert for the Budibugyo virus disease due to the extensive population mobility with the DRC and Uganda.
Cumulatively, as at 13th, we have 91 samples from 88 alerts that have been tested, and all have actually tested negative.
In Busia, Kenya Red Cross has donated personal protective equipment to the Busia Referral Hospital as the country prepares itself for Ebola eventuality.
The Kenya Red Cross is working very closely with the Ministry of Health of Busia to ensure that we are well prepared and our communities are also informed in terms of Ebola information, that is towards what are the symptoms, what are the signs, and how best can they be able to prevent.
Hivi sasa tuko nafanya ruti mingi, lakini tumejaribu sana kuongea na health staff na pia partners wetu kama Red Cross na wengine kama Kemri, na tayari tunafanya screening katika formal crossing na pia porous points.
Nancy Okware, Prime Edition.